The common denominator across all the laparoscopy skill training devices offered by Laparo medical simulators is the Laparo training program. It is included in all of our devices, from the most basic low-cost pelvic trainer boxes all the way up to our high-end medical simulation center oriented devices. This program was really designed with the goal of optimizing and improving the experience of learning how to use laparoscopic instruments inside of the operating area. And actually the idea is quite simple. Like with any complex skill, the best approach to teaching someone is to break it into smaller and easier parts and teach those parts separately before adding everything together. So by gradually introducing new concepts, we can also gradually increase the difficulty. And we can prevent in this way the learning curve from being too steep or too frustrating to actually make it fun. The Laparo training program actually works kind of like a video game with levels. Each exercise in the Laparo training program is actually situated on these plastic elements that we refer to as modules. And the idea is that every module can be easily reconfigured and modified for every exercise individually. So multiple modules, or actually multiple exercises, take place on a single module, and the trainee simply assembles a different assembly from these modules for each exercise. So the Laparo training program actually places a very strong emphasis on developing suturing skills. So-called intracorporeal suturing is a unique skill for laparoscopic surgeons. It often requires years of practice and a high level of manual dexterity. However, once mastered, it can be actually very useful in the OR, and this is why many laparoscopic surgeons, either practicing or aspiring, are always very interested in pursuing this skill. The Laparo training program is actually divided into 4 distinct parts. The basic skills, basic suturing skills, intermediate or instrument-specific skills, and then advanced suturing skills. The exercises are presented along with short educational segments which explain certain core concepts like ergonomics, instrument properties, knots, and many other useful facts and tips. To perform all the exercises included in the program, the user must have the total of 4 modules and all the different accessories that are included in the package. And each exercise is actually a unique assembly of the different parts of the different components. And you can sort of think about this as like a Lego set with instructions on how to assemble a particular exercise. Level 1, basic skills. This course walks the trainee through 14 different exercises which are focused on developing very abstract instrument handling skills. This level is based on 2 modules, is the tension module and the other is the dexterity module. And each exercise allows the trainee to develop an understanding of specific properties of instrument movement through practice with rubber bands and cones. There are actually 3 fundamental reasons why laparoscopy is hard to learn and hard to teach, especially at the very beginning. The first is that the instrument movement inside of the operating area is actually inverted due to the fulcrum effect. So when we move the instrument handle to the left, the instrument's tip will move to the right, and vice versa. Similarly, the insertion and the removal also is kind of difficult to get a grasp for. The second reason is that we can't actually feel any of the tissues with the tips of the instruments. So we don't really have, or at least we have very limited tactile feedback coming from the tip of the instrument. So we don't actually know whether a piece of tissue is softer or harder sometimes. We have very subtle cues coming through the shaft of the instrument. The third reason why laparoscopy is hard to teach is the lack of depth perception. The image that actually comes from the camera is a 2D image on the screen. And due to this, we don't actually see very well the movement of the instrument in and out away from us when we're inside of the laparoscopic operating area. So it is very important with such exercises to develop a sort of muscle feel for the depth of movement. So it is often the case that young surgical trainees have a hard time understanding these three fundamental concepts. And when they jump in and try to attempt more challenging exercises, there will really be several things that they have trouble with at the same time. And because of this, the process of learning how to use these instruments can be very frustrating, or can be so frustrating that people want to quit. But in our work with laparoscopic surgeons, we have identified certain habits that can be useful to develop very early on. And many of the exercises included in the basic skills training program are actually focusing first on some of these habits. And thanks to completing the basic skills program, trainees are actually much better later on at learning how to suture or at learning how to perform other complex movements, because they don't have trouble with the basics. So the basic skills level is actually created to be quite challenging, and we find that it can take up to several weeks of practice for trainees to actually complete it, depending on the amount of time that they dedicate. However, we also see that trainees who completed basic skills have an easier time completing the more advanced courses and simulations later on. So there's a very strong benefit to taking the basic skills course seriously. After completing the basic skills level, the trainee can then begin to learn suturing. This course actually takes place entirely on the suturing module. And it splits up suturing skills into easier to learn sub-skills first. By first training, for instance, to rotate and handle needles, and then separately to tangle and untangle pieces of rope, the program actually separates challenging aspects of the skill, and this makes it easier to practice them separately. This approach is unique to the Laparo training program and has already delivered impressive results during our laparoscopy training workshops. The intermediate skills chapter are a mix of exercises that mostly take place on the tissue holder module. These exercises actually rely on mostly consumable silicone inserts, which simulate certain properties of real-life tissue. And by doing these exercises, the surgical trainee can learn how to execute blunt and sharp tissue dissection, as well as simulate vessel clipping, ligation, and even resection. The previous exercises in the basic skills and basic suturing training program actually only expose the trainee to hard, solid plastic elements and to the suturing itself. These exercises are the first to show how the tissue actually works. This course also includes valuable techniques for handling laparoscopic scissors, as well as tricks and tips for using clip applicators inside the operating area. Level 4, or Advanced Suturing Skills, is actually the fourth and final chapter in the Laparo training program. So the Advanced Suturing platform is actually used to create more challenging configurations. In several exercises, this platform limits the amount of space available around the target tissues. And this is interesting because when we attempt suturing, we have a tendency to wave our instrument tips widely around, and that isn't a good habit in a small, contained operating area. In several other advanced suturing exercises, the suturing platform is used to suspend silicone inserts for learning how to suture under tension. It concludes with several anastomosis exercises, which are intended to be challenging even for skilled practicing surgeons seeking to push their skills to the limits. It is noteworthy that when used in higher-end Laparo medical simulators, such as the Analytic or the Apex, the exercises in the Laparo training program are accompanied with a specialized scoring and assessment system. This system is very useful for identifying problematic instrument movement parameters and mistakes, and it is also proven to additionally build good habits in the trainees learning on those devices. In conclusion, the Laparo training program is a cornerstone of the training methodology offered by Laparo medical simulators. The program requires the user to have available 4 unique modules and the relevant accessories. It is intended to be challenging for both complete novices and advanced surgeons. The program is made up of 51 unique exercises, which can take up to several months to complete. The program is best used with Analytic and Apex. However, it can also be accessed in all Laparo medical simulators.